be here and to be with you all. And so we will get started. My name is Risha Burke. I'm from Community Living Brant. And we have some panelists for you tonight to speak about the COVID-19 vaccines. But before we go any further, before we get to that, I'd like just to thank the partners who kind of got together, who thought this might be a good idea to do. So we have Linda Hunt from Accessibility Solutions, and we have Rachel Goodland from River Community Health Center, and we've got a couple folks, Carrie and Ian from the Brantford Haldeman Norfolk Legal Clinic, who helped out with this. And of course, we've got our own Brant County Health Unit, of course, Sydney Royston, who's there, and also Maritza, from Grand River as well, and myself, Risha Burke. And so, yeah, we're here and really super happy that you've all decided to join us. A great turnout. Just wanted to say that the intentions of this webinar were to, we felt like there was lots of questions about the vaccines in the community, and we thought it would be, seemed like a good idea to create an opportunity in the community to answer questions and just find a way of getting some good evidence-based information out to people. So a number of you, which we're really thankful for, just over 20 people actually took the time to complete the pre-webinar survey, which gave us some great pre-questions for our panelists to work with. And they have designed their presentations tonight with those questions in mind. So hopefully we'll get to most of the questions that were asked. There was lots of really great ones. So each panelist is going to address those questions, what you can expect after that. We've got some resources to share with you, and then we will use the question and answer function at the bottom of your screen. So hopefully you can see that. You'll see Q&A, and we'd really like you to use that to be able to ask questions to us. And so those questions, when you place them up there, are anonymous. So you don't, not everybody else will see them, so you don't have to feel shy. You can type them in there, and just Rachel and I will be looking at those questions, and we'll have a time and additional time to answer more questions if we have something that didn't get addressed during the presentation. So hopefully everyone can find the Q&A function at the bottom, and that will be really helpful to us. Yeah, so I think we will, and we will do our very best to answer as many questions as possible. We are recording this, but is not live streamed to anything. It is just for, we'll look at whether or not we should share that later. But again, your participation is anonymous and no one can see you or your name. So just so you know that you have that anonymity. I am going to turn on the live transcript now. And so wanted to do this for accessibility. I tested it out. It's a little bit, it's very phonetical, and it doesn't always get it exactly right, but felt like it was really important for the live transcript to be there for folks. So I'll leave that up, and that will be part of our presentation as well. So without further ado, I am going to ask Sydney to come on. Sydney Royston is a public health nurse with the Brant County Health Unit, and she's going to start off our evening with a presentation addressing a lot of the questions you have specifically about the vaccines. All right, so Sydney, if you want to go ahead and share your screen. Perfect.
I see it. Aha.
Okay, can you see my screen, Risha?
I sure can.
Okay, let's pull this up. Okay, first, welcome everyone. It's nice we have such a good turnout today. I'm hoping this presentation can give you guys some information on COVID vaccines, as well as a chance to answer any questions you have or direct you to where you can find an informed answer. So just a little bit what I'll review. what exactly is COVID, some general vaccine info, who can and cannot get the vaccine, consent for vaccination, vaccine availability, and what to expect after being vaccinated. So a lot of you probably already know this, but just an overview of what COVID-19 is. It was discovered in 2019 after several reports of cases of pneumonia in China. Infections are diagnosed based on lab testing, including nasopharyngeal swabs. Some common symptoms that we're seeing of COVID-19 include fever, new or worsening cough, shortness of breath, new olfactory or taste disorders. Of course, there's a lot more symptoms, but those are just some of the ones we see more commonly. It is spread through droplets from a cough or sneeze from an infected person, similar to how influenza and other respiratory illnesses are spread. So an overview of how the vaccines work. They work by presenting our body with something that looks like the infection so that our immune system can learn how to produce natural protection. Natural protection then helps us to keep us from getting sick if we meet the real virus in the future. So both the Pfizer and Moderna vaccine use a method called messenger RNA. The mRNA is like a code that tells the cells in your body how to make a piece of the outer lining of the virus for a short time. The AstraZeneca, which is the newer vaccine that's come out, is a non-replicating viral vector. So an overview would be showing our bodies how to produce the immune response needed to ward off future infections. I think this would be a good time to just point out that you cannot get COVID-19 from the vaccine. It is not a live vaccine, so it will not make you sick. This is just a little photo visual of how the vaccine works. It's from the CBC News website. So these are just some key information that we're hoping you want to know or will know about the vaccine. So it's given through an intramuscular injection into the deltoid muscle, so your shoulder area. Health Canada has authorized vaccines to protect individuals against the COVID-19 virus. So these would be the Pfizer, Moderna, and AstraZeneca. The day of your appointment, it's important to bring your health card, wear a loose-fitting top or shirt so that the healthcare provider can easily access your arm for the vaccination. It's important to note that you should not attend the clinic if you have symptoms of COVID-19. And then after the vaccine, you'll be asked to stay for 15 to 30 minutes after you receive it to monitor for any adverse events. So an overview of the benefits to being vaccinated is that it helps protect against COVID-19 symptoms. It will help you fight off the virus if exposed, and it may also help protect people around you, because if you are protected from getting infected and from disease, you're less likely to infect someone else. And this just who can get the vaccine. So in the community, who's available to get it right now. So you must be 16 or older to receive the Pfizer vaccine, and then 18 years or older to receive Moderna or AstraZeneca. You should be assessed by your doctor and cleared to get the vaccine if you're immunocompromised or have any chronic health conditions. So we really recommend talking to your family doctor if you have any questions related to your specific illness or chronic health conditions. They'd be able to know your history well and give you an informed decision, weigh out the benefits and risks for your specific situation. If someone is pregnant, breastfeeding, or planning to be pregnant, they can get the vaccine. If you've had COVID-19, you can also get the vaccine after you've been cleared. You need to wait 30 days until after you have been cleared from self-isolation to receive the first dose. A question that we got in the survey prior to this was, what if you've had the first dose and then you get COVID? So you would need to wait again 30 days between your clearance date and the second dose, and we do recommend getting the vaccine. So who cannot get the vaccine? So you should not get the vaccine if you've ever had a severe allergic reaction to a previous dose of an mRNA vaccine or to any of its components. You will not be able to receive the vaccine if you have any symptoms that could be due to COVID-19. So, any acutely ill individuals would not be eligible. Anyone allergic to the specific vaccine that you're getting would be contraindicated. Individuals who have received another vaccine, so not a COVID vaccine, in the last 14 days would not be eligible to get the vaccine until that 14 days is up. And precautions during vaccination will be taken for individuals with bleeding problems, severe allergic reactions, not related to vaccine components. So they might ask you to wait a little bit longer than the standard 15 minutes just to monitor for any adverse events. And then this is the COVID-19 vaccine consent form that will be provided to you on the day of your appointment if you choose to get vaccinated. It just goes into a little bit about your demographic information and health-related questions necessary for the nurse to know before vaccinating you. Included in the consent form is questions regarding immunosuppression, allergies to specific components in the vaccine, if you are pregnant, breastfeeding, bleeding disorders, etc. So our current availability of the COVID-19 vaccines. So the first shipments of the COVID-19 vaccine were delivered to Brant during the week of January 10th, 2021. On January 14th, the Brant County Health Unit, along with assistance of our various community partners, began mobile vaccination clinics to immunize residents and staff in long-term care homes in our community. And then moving forward, the Brant County Health Unit website and our social media stays up to date with who's eligible for vaccination and the links on how to book it. So what to expect after being vaccinated. So you'll be asked to wait the 15 minutes, like I said, after receiving the vaccine to ensure you're feeling well and inform a staff member if you're feeling unwell while waiting. So there's people that sit with you and monitor just to make sure there's no adverse events. And then they will guide you to check out at the checkout station when that 15 minutes is up. So after you're vaccinated, you should continue to follow advice of public health officials to prevent COVID-19, such as wearing a mask, maintaining physical distance of 2 meters from other people outside your household. Common side effects may include pain at the injection site, fatigue, headache, a fever. And then one more point to add here, after you get your vaccine is you should not receive any other vaccines until at least 29 days after you receive the second dose of the COVID-19 vaccine. Continuing on there, it's important to note, even once protected, you can still carry COVID-19 and pass the virus on to others. So after you get the vaccine, you should continue to do all these things that public health officials have been saying since the beginning. So wearing a face mask, practicing physical distancing, staying at home while you're sick. And then I just want to move forward. These are some of the frequently asked questions we have. And then some of them did come from members of the webinar today that they asked prior to, and I just wanted to try and touch on as many as I can. So if the COVID vaccine is still effective, is it still effective if the time period between doses has extended? So a lot of us know that the time between doses has been extended. And the answer is yes, it's been approved by Health Canada. BCHU is following recommendations made by the NACI Committee on Immunizations. Next question that we got was, what happens if I miss my vaccination group? So if you didn't go or book your appointment at your eligible age group, like someone was wondering if they missed their chance at getting it. So the answer is no. You didn't miss your chance. You're still eligible and may receive your vaccine at any time after your age group or category has passed. Another question was, if I've had a reaction to the flu shot, should I get the COVID-19 vaccine? The answer would be yes, but however, you should speak to your family doctor beforehand. And then the big question here is, what is the point of getting the COVID-19 vaccine if I still must wear a mask and still can get COVID-19? So it's important to note that it reduces the risk of developing the illness and its consequences. So some of the severe symptoms that we see in people, the COVID-19 vaccine can reduce. And there's no research thus far is showing that the vaccine won't work against the variants of concerns that we're seeing in the community. And that's the end of my information about the vaccine. I would encourage, if there's any specific questions related to health concerns or disease or anything like that, to reach out to your family doctor and get their opinion. And then we would also encourage you to reach out to BCHU for any additional questions regarding the vaccine and get the right answer for you. I'm just going to end my slideshow there.
Thanks, Sydney. And I can see that there are a few questions that are starting to come into the Q&A section. So we will address those. And we're just gonna have Ian speak next, and then and so feel free, and as Ian's talking, there might be other questions that come up in your mind. Please add them there, and we're going to come back to all of those questions. So I'd like to introduce Ian Aiken to you. He is the Executive Director of the Brant Haldeman Norfolk Legal Clinic. I've met him now just a couple times. He's a lot of fun. And so I think you're going to enjoy this. I'm going to
say so, yes.
Yeah, so don't disappoint.
Okay,
And a number of your questions from the survey did speak to some legal pieces about the vaccine. And so we're really thankful to have the legal clinic as well as the Brant County Health Unit here. So I'm going to pass it over to Ian to share his screen, and he's going to give a little presentation.
Very good. Thank you very much. And I am delighted to see so many people with us this evening. I am going to try to share my screen. Let's all hope that that works out. I have bated breath from beginning. Oh, how delightful. Okay, so you should see just the cover page, and we will get to, and I was delighted that we had a survey ahead of time, because there are some specific legal questions that I hopefully will be able to answer. And believe it or not, I've learned a number of things during this process, because I had to do some research about compensation and all that sort of thing. I will say though, because COVID and the vaccines are new, they've created a lot of legal questions and issues. I'm going to try to provide as clear information and answers as I can. However, you can imagine in some cases, in some questions, there aren't going to be any clear legal answers. And I also have to say, and lawyers always have to say that we're not, or I'm not able to provide a specific legal opinion or advice about a specific person's case or situation. What we're hoping to do today is give you information to determine whether you have a concern or a question, and whether you need to talk to somebody specifically about it, whether it's a legal professional or your doctor or somebody else. So if you do run into, if you have a specific question now about your particular case, or you run into an issue down the road, please reach out to our clinic. Our services are entirely free. You can contact us. We will give you advice. If we're not able to give you specific advice on your situation, we will refer you to somebody who can. So please don't hesitate to reach out to us if you have to down the road. So I'm going to start with, because this is a great question, it's very unlikely that you will be forced to take a COVID vaccine by the government, as this would likely be against the Charter of Rights and Freedoms. And the Charter, you've all heard of it, but there is a section in the Charter that says we have security of the person. So basically somebody can't force something on us that could potentially have an impact on our health or damage our body without a really, really, really good reason. And the courts have said, with respect to flu vaccines and other types of vaccines, that the government can't force everybody to take the flu vaccine, for example. Now, that doesn't mean, and we'll talk about this specifically, you could be required to take a vaccine because of the specific employment you're in, or in other situations, such as travel. For example, the Canadian government is publicly talking with other countries about vaccine passports. For example, if you want to travel into another country, you may have to show proof of vaccination, or a reason why you haven't had the vaccination. But it's very unlikely, as I've said, that the Canadian or Ontario government could just say everybody has to be vaccinated. And that's because of the charter, and because of the Canadian our political reality, and the way our governments are structured. There are countries where I would not be surprised if the government did require everybody to be vaccinated who didn't have a very good reason why they couldn't be vaccinated. I'll give you an example. My daughter is currently living in Australia. I would not be surprised that the Australian government would require everyone to be vaccinated for COVID, but it's a very different country, and it is a very different constitution. So, for example, in Australia, whenever there's an election, everybody in Australia has to vote. They're required to vote. They also have a very different view of, currently certainly a very different view of their government, because in Australia right now, there's very, very little COVID because the government has done a very good job of managing COVID and infections. So in that kind of political environment, I think that could happen. The reason I mention that is you may hear of other countries going ahead with vaccination for everybody, but as I say, I don't think it will happen in Canada. The federal government has promised to put a compensation plan in place if you are harmed by a COVID vaccine. So they've publicly stated that. However, they've also said that there's no specific details yet. And I was interested to learn that Canada is one of the only G7 or very prosperous countries in the world that doesn't have a compensation plan in place for somebody who's harmed by vaccines. So it is important that you know that type of government plan will be put in place. I don't know when, I don't know the details, but the federal government has promised to do that. One of the questions that we had was, if somebody is injured because or has side effects, significant side effects because of a COVID vaccine, could they look to the vaccine manufacturers for a remedy or for damages? And I will say that is very, very unlikely, because with vaccines, essentially, the companies who produce them basically do it on a non-liability basis, which is why the federal government is going to put that compensation plan in place. The other thing that's very important to understand, that the Ontario Human Rights Code specifically allows a person to refuse a vaccine because of health reasons or a disability. And there could be other grounds as well, for example, religious beliefs. And that is not contentious. For example, in Ontario, you are allowed to exclude your children from mandatory vaccinations based on religious beliefs, or because of health reasons, or because of a disability that's going to have a negative impact. So I think it's really important to understand that if there is that protection, and that is something that's, as I say, not contentious at all. Now, when we talk about employment, vaccines, and COVID, that's when things get rather sticky. There are lots and lots of laws that could have an impact on whether or not somebody has to be vaccinated in a workplace. And the majority of those issues are going to be covered by what you see in the screen. The Ontario Human Rights Code, I've just mentioned, Charter of Rights and Freedoms, the Occupational Health and Safety Act of Ontario, which I'll speak to in a minute, but that's a really important piece of legislation with respect to COVID and vaccines, because the Occupational Health and Safety Act essentially requires the employer and the employees to maintain a safe workplace. There's also specific workplace legislation, such as the Long-Term Care Homes Act and There's a daycare act that that currently requires people who are working in long-term care homes or in daycare to be vaccinated if they're going to work in those work environments. I will say that right now, that legislation or those regulations have not been changed to include a COVID vaccine, but if these vaccinations or certain vaccinations are already required, then it wouldn't be much of a step to require people working in a long-term care home to be vaccinated for COVID as well. Unionized workplaces are going to have specific collective agreements that will impact on whether or not somebody has to be vaccinated. And there's lots of case law on that. But if you're in a unionized workplace, because of the collective agreement in that workplace, it's going to be often very much different than working in a non-unionized workplace. The other two pieces of legislation are the Workplace Safety Insurance Act and Employment Standards Act. They deal more with what happens if you do catch COVID in the workplace versus whether or not you have to get vaccinated. Okay, so the Ontario Human Rights Code. If you have a disability that would be negatively impacted by a vaccine, you can't be forced to be vaccinated or fired for that reason, period. So, if you have a verifiable disability, and for example, you have support from a treating physician that says, no, this person, because of the disability or some other protection under the Ontario Human Rights Code, they should not be vaccinated, then you don't have to get vaccinated. And you can't be disciplined or fired for that reason. Now, it could require the employer to accommodate that disability. So I could imagine in our workplace, for example, in our law, we run a law office. If somebody, because of a disability, is not able to be vaccinated, well, they can't be let go because of that reason. However, we would have to probably take steps to ensure that their health is protected as much as possible, because they haven't taken the COVID vaccine, and they're not going to cause an elevated risk to coworkers or the public. So one of the obvious ways to accommodate that would have that person work from home and continue to do the work that they do here, but they would do it from home. Now, Charter of Rights. Generally, the Charter protects a person's security of a person. I mentioned that earlier, religious beliefs, mobility, and equal treatment, but within limits. So the government is able to make laws and make decisions and force people to do things if they put legislation in place, but only within reasonable limits. So, and governments do this all the time. They say, well, you have the right to specific beliefs or security, but we are going to put some restrictions on those. And we have a really good reason. And if the courts say, well, it's a really good reason, and they're only limiting the security or the religious belief or equal treatment to a minimal extent, then that doesn't mean, well, that means that the legislation is valid and can be enforced. The other thing that's really important to understand is that there's also, under the Charter, there's also a positive duty or obligation on the government to protect persons. And we often don't talk about that, but the Charter not only says, look, you're protected from government action, but the government also has a duty and an obligation to put legislation in place to protect people. So it is possible, for example, that and we're seeing it now in Ontario, where we have another province-wide stay-at-home order. that is a restriction on a charter right to mobility. But I would expect that the courts would say, well, that is a restriction, but it's only limited. It's limited for a certain period of time. It's for a very specific reason. And the reason that that stay-at-home order is being put in place is to actually protect the people who live in Ontario. So there is a duty to protect the public that the charter also speaks to. Now, we can argue, and I'm happy to argue, perhaps not this evening, about whether a specific stay-at-home order or any other legislation is actually appropriate under the charter. But there is, as I say, a duty on the government to protect persons. So, therefore, generally, you would not be able to refuse a vaccination in the workplace if the employer can prove the vaccination is a reasonable limit. And I'm going to give you the clearest example that I can think of. When you go into a grocery store and you're buying your groceries, and at the checkout, the person checking out your groceries could say they've been asked to vaccinate, but they refuse because they don't want a vaccination. And then the employer says, well, I need everybody who's working here to be vaccinated, unless it's contrary to the Human Rights Code in this particular case, but I need everybody to be vaccinated, because if you're not vaccinated, there's a higher risk that you could catch COVID, you could pass it on to your co-workers, and you could also pass it on to the public. And an employer, and sorry to be a lawyer, but if I go through a checkout and I can show that I caught COVID from somebody who's working there who chose not to be vaccinated, one of the first things that a lawyer would say is, well, you can sue the employer, because they permitted somebody working in this work environment to not get vaccinated, higher risk of passing COVID to people who come into the store, and the employer would be sued. So there's very practical reasons for that. I'm going to go back a bit, because I'm going to give you another example. The Child Care and Early Years Act and the Long-Term Care Homes Act in Ontario currently can require workers to be vaccinated. And that is government legislation that's put in place that is appropriate under the charter and under workplace legislation. And the whole idea behind those current vaccination rules is to protect the people that they care for, the people who live in long-term care and the children that people take care of. It is important to understand that right now, I'm not suggesting that right now that legislation says you have to take a COVID vaccine, but I would expect that down the road, that legislation would be changed to include COVID vaccines. And from everything that I can see, that type of requirement in those types of workplaces would be okay under the charter. Occupational Health and Safety Act. So this is going to be really, this Health and Safety Act that we often don't talk about or think about is going to be really, really important when we look at COVID and vaccines, because the act requires employers and employees to take action to ensure a safe workplace. If a workplace is unsafe, an employee can complain and has a right to refuse work. One of the obvious examples are guards on machines in workplace. If there's no guards on the machine, or they're broken, the employee can say it's not safe, I'm not going to work. The Ministry of Labor comes in and says, nope, you have to fix it, because if they don't fix it, then the person gets injured, the employer gets a fine, et cetera, et cetera. And it's not legally, it's not far, it's an entirely different protection, a guard on a machine versus a COVID vaccine that provides protection, even some protection from catching COVID. but it's not a far legal leap to go from guards on machines to COVID vaccines are required, particularly if the workplace, where risk of transmission is high. Okay. I just earlier mentioned the Long-Term Care Homes Act. So there's already requirements in the law to have specific employees to be vaccinated because it's so important to protect the people that they take care of. I mentioned, the employers in the workplace have to protect employees and the public. So if not, the employer can be sued for negligence, essentially. So that's another reason where it can be required. I'm going to quickly mention again, unionized workplaces. If you're in a union, it can be a very different conversation because there's going to be a specific collective agreement that may speak to this. And in the past, there's been lots of unionized workplaces where workers have not been required to take the flu vaccine. So we may see some of that, those arguments and those decisions bleeding over to the COVID issues. Easy answer is if you're in a unionized workplace, you need to get direction from the union. Workplace Safety and Insurance Act and Employment Standards Act. Quickly, if you are in a workplace and you need time off because of COVID or any other reasons, then you need to get, first of all, legal advice immediately to look at what benefits you're entitled to, and specifically with workplace safety insurance. If you're covered by workers' comp and you catch COVID, then that has to be reported and you will potentially be entitled to workers' comp benefits. So I'm going to just recap. Again, the law is not clear yet because it's very early days, but most legal employment experts indicate these basic principles. An employer can require an employee to get vaccinated, essentially to ensure a safe workplace, except, as I've mentioned, if there's a health or religious exemption or some other exemption under essentially the Ontario Human Rights Code or the Charter, but mostly the Human Rights Code, because that applies mostly to employment. If an employee, this is very important, if an employee refuses to get vaccinated and they don't have an exception, then they may say, well, I'll just work from home. However, there's no right in law to work from home if an employer asks you to come to the office. Okay, it's an option. And certainly, as I mentioned earlier, if somebody can't take the COVID vaccine because of a health issue or a disability, then that shifts the duty to the employer to accommodate the fact they can't take the vaccine. And the easy answer is they can work from home. But it's in law, if an employee is asked to vaccinate and come to the office, they simply can't say, no, I want to work from home or continue to work from home. So now, and if anybody thinks that this might happen to them or a friend or a family member, this is not specific legal advice. What this next statement means is if you think you might run into this type of issue, you need to speak to us or a lawyer or legal professional immediately. Because if an employee refuses to get vaccinated, then an employer will be able to end their employment, terminate their employment. And in some cases, they could be terminated for cause, which means they're not entitled to any money or severance or benefits if they're let go. That's in the worst case. Okay, but again, if anybody thinks they may be running into that type of issue, they need to get legal advice about their specific case, because there's going to be lots and lots of facts and variables that need to be taken into consideration. And just to repeat, me saying that a workplace, an employer can require employees to get vaccinated is very different from the government saying that everybody in Ontario or everybody in Canada has to be vaccinated. I don't think the government can require that. However, I think vaccination going forward will likely be a necessary term of employment in most workplaces. That is the end of my comments. Happy to answer any questions. I know we'll try to get some questions to us. As I mentioned, our services are free. We're happy to answer the question. If you contact us, answer your questions or refer you to someone who can. There's some basic information on the screen on how to access us. So thank you all very much for listening so quietly to my presentation.
Thank you so much, Ian. That was great, very informative. So if I can get you to stop screen share. Perfect.
I just stopped.
Excellent. We do have a number of questions that are out there. Actually, there's 16 in the thing there, and we've got. I've sent Ian. There's one that's specific to you at least, so I've done you a direct message. So if you want to start to ponder that, and there's just a whole whack for Sydney here. So I'm gonna, and Rachel and I are gonna try and stick handle that. So we'll see how far we get. So I'm gonna start with, here's an interesting one for Sydney. I'm not sure if you're able to answer this or not, but it says, my 18-year-old son is going to school in the United States the 1st of August. Is there any way he could get the vaccine? It's a bit of a priority for his safety.
So totally understandable. I see where you're coming from, but I do not have the answer for that. I can't give answers to individuals and their situations that they're in. Sorry about that.
That's maybe something that, talking to your family doctor to present that case, that might be the way to go there. All right.
Sydney, I did see a question about what if you work in one community but live in another? I can use an anecdote to respond to that and say that I work in Brantford, but I live in another community. And because I worked in Brantford and I was in a more like frontline position, I was able to be vaccinated in Brantford just because of my workplace situation. So I would think that the answer would be like wherever you are like on the list first, whether it's in the community where you work or the one where you live, would be where you get vaccinated. Does that sound accurate, Sydney?
Yes, that does. I believe we first go by Brant and Brant County residents at the vaccination clinics, but again, reaching out to the health unit, the specific managers there that would go over that would be a good route to take. I don't have the specific answer of who can and cannot get vaccinated at our clinics, but yeah, that sounds right.
Yeah, and I think they organize through your workplace sometimes as well, so you would hear probably from your workplace.
Yeah, like I know, like the long-term care homes, if you worked in a long-term care home in Brantford, you could get immunized at their clinics, and at our congregate settings that we're in the middle of doing, if you work there, the clinics have been at those locations, so yeah.
Here's just a really quick question. I know the AstraZeneca vaccine sometimes confuses people, so here's a great question. I read that you had to be 55 plus for AstraZeneca, but the information you provided was that it's available for people 18 and up.
Yeah, so the AstraZeneca that's new to us right now, it is only being offered in our pharmacies in our community to people 55 and older right now. It has been suspended for anyone else younger.
Just a quick process question. I see a question here that someone had completed the consent form and took it with them for that first dose, but no one took it. They asked about it. We were told that they didn't need it. So unsure of the purpose of completing the form.
I would say that the screening questions that you were asked when you sat down and were about to be vaccinated, the nurse that asked those specific questions, those would be about the same ones that are on the consent form, asking about immunosuppression, allergies, etc. would have been asked then. So I would say that they got the information that they needed in order to give you your vaccine.
I'm going to throw a question out here. This one might be for Ian. It's a question about essential caregivers. So being deemed, I'm not sure if you can answer this or not, but what if we are deemed as an essential caregiver in some jurisdictions, but not in Brant?
Oh, and I'm live. Oh, yeah, that's a great question. I mean, I would have to kind of muddle through that. I mean, it's a great question, but the answer is not going to be straightforward. For example, I mean, I've been trying to get a vaccine. I meet about 3 different target groups, right? I attend congregate settings. I'm over 55, much older than 55, right? But depending on where I try to register, I'm asked different questions. So I mean, as a lawyer, I would suggest, well, I don't think it matters where you live. The question is, are you an essential worker? And if you're defined as an essential worker in a particular area, then you should be eligible under those criteria, and you should be able to get the vaccine. So I guess, for example, I guess it depends. I mean, if you live in Brant and you work somewhere else as an essential worker, well, maybe they won't give it to you in Brant because they don't consider you an essential worker because they're using different criteria. But then I would suggest you, wherever you're working, you go there. I mean, that's a very pragmatic answer, but that's what I would do.
Oh, sorry, Risha, you're on mute.
I am on mute. Thank you. Our favorite saying of the year. While we have Ian, there's a question here, another one. Did I just lose it? Oh, yeah. Thank you for highlighting the employer duty regarding employees and vaccines. Would the same apply to independent contractors? They are in high-risk environments working with children, and the ministry needs them. Ministry does need them now to show proof of certain vaccines.
Okay, well, what a fabulous question. So I think, again, to be very, very pragmatic, if the ministry currently requires somebody to show proof of certain vaccines, then I think that's analogous to what I was suggesting earlier with the legislation that's in place in certain workplaces. Then if the ministry is saying, look, you are a independent contractor, but you're providing, you have to be vaccinated or have certain vaccines because you're going into a work environment, even though you're an independent contractor, you're going into a work environment where the people you're working with are at risk, whether they're elderly, developmentally delayed or whatever. So I think if the ministry has taken a position they have to be vaccinated, then I think it would be appropriate for the employer. That's one of the problems with independent contractors, right? I mean, independent contractors, if they're actually truly independent contractors, then they're responsible for getting the vaccines. They're responsible for getting their own liability insurance, and they should be getting the vaccine just to ensure they don't get sued. but then we get, then we get into the issue of whether an Uber driver is actually an independent contractor, and everything that I know says they're not, right? They're not independent contractors. But could Uber say, look, if you're going to drive for Uber, you have to get a vaccine? Yeah. Uber could say that, because they would simply say you can't work for us or be an independent contractor. So easy answer is, yeah, if the ministry says you need proof now, then they should be for any number of reasons getting vaccines, unless again there's there's an exemption. Yeah.
Great. Thanks, Ian.
Sydney, we have received a couple questions about the increased wait period between the first and second dose. Wondering if you could speak a bit to the, I guess, decision-making behind that, if you know it. And also, if folks are waiting for their second dose and they're not sure when they're supposed to get it, what they should do.
Yeah, so I'm actually going to pull right from our BCHU website just about the increased time period between the first and second doses. So the National Advisory Committee on Immunization to extend the time interval between the first and second doses of the current Health Canada approved 2-dose COVID vaccines, it has now been increased to 16 weeks. So it's not a health unit specific decision, it comes from Health Canada. So as a result of this decision, public health units across Ontario have been directed to make adjustments to pre-existing second dose appointments for those that do not fall within the new 16-week dose interval. So will allow Ontario to rapidly accelerate its vaccine rollout and maximize the number of people receiving a first dose within a context of our limited supply. I know there was another question, I can't remember the specifics to it, but it was about individuals with health conditions. So it does say that we will still immunize individuals with items such as transplant, stem cell, or solid organ, and those on stable active treatment for malignant cancers, not including radiation, but they may receive their second dose of COVID vaccine at the recommended interval and not the new recommended 16-week interval. So we will immunize at the recommended dose that we knew before.
Great. There are a number of questions here as well about folks with developmental disabilities and their specific, compromise. I was wondering so there's a question that someone with a developmental delay works with 14 or 15 other folks in the same situation. Should they be vaccinated, or should they have to, or do they have to wait for their age group? And right now their age group is not the priority group.
Yeah. And can I speak to that? Because just as a general statement, I think one of the things we've talked about in preparing for this was how important, and even more important, the human rights, and in particular the Ontario Human Rights Code, plays in these types of emergency and really difficult situations. And I did want to say, and it kind of speaks to this, but I did want to say, for example, there was a recent case from the Ontario Human Rights Tribunal where the tribunal said really succinctly that human rights protections do not go away in a pandemic. And, from my point of view, human rights protections are even more important in a pandemic. When people are struggling, right, then that's when we really need human rights protections. And in that case, the situation was that a young man his family was being prevented from visiting him because of visitor restrictions in the particular place he was living in. And the Human Rights Tribunal said, no, right? It's very important that he spend time with his family and interact with his family. And we need to use the Human Rights Code to put accommodations or protections in place so his mental health and his health are protected. So they basically said, no, his family can come and visit him with appropriate protections. when I look at a question like this, I mean, I'm sorry, the easy answer is, any person who's developmentally delayed should be in the priority group or groups, and should probably go ahead of someone like myself, who's 60 years of age and, depending on the day, in relatively good health. But if the question is, should they be vaccinated without having to wait for their age group? Yes. How to accomplish that? I think advocacy with, if there's other older people that they're working with and they're getting vaccinated, then advocacy with whoever's doing the vaccination to make a pitch and say, look, this is important for everybody's protection. And guess what? We think that because they're covered, our daughter is covered by and should be protected under the code, we want her vaccinated, and make some advocacy and push for that inclusion. I'd love to say, apparently in Brant, you can apply, and I've applied to get a vaccination if you're over 55 from a pharmacy, but I don't know how long that's going to take. I'll stop talking.
Thanks, Ian.
I don't know if that helps.
Hopefully, no, that's good information for sure. There are also, and there's a number of questions here. I can see some about childcare settings, and also just a number of straight up questions. When are educators going to be vaccinated? So maybe that's a question for Sydney. I know there was some talk about that in phase 2 announcements today, but a specific question about childcare settings that are maybe not under the licensed childcare laws. Can we still require vaccination? So that's a question for Ian. And what about testing? How do we protect staff and families that we see even during a lockdown? Because those folks, our childcare providers, are hard at it all the time. So, and we thank them for the work that they do. So there's a bit of a legal question there, and then a question for Sydney around if we have any timing on educators.
Right. And can I'm going to suggest that the person with that specific question about, providing not under licensed childcare laws, they should call me. 519-752-8669, extension 23. Call me tomorrow, and I'll try to chat more about that, because that's a really interesting issue. And I don't know the mechanics of the workplace, but we can chat about that.
Awesome. And we will make sure we get that information up again before you leave. So if you didn't get a chance to write that down, don't worry. Sydney, are you able to speak to the question about educators?
I can a little bit. I can't speak to exactly when educators can get vaccinated. I don't know the specific week or when we'll know. The health unit just follows our government on when we can offer it to specific populations of people. I would recommend checking our website frequently, our social media, but as soon as it's available for educators, we will make an announcement and email our boards to make sure that everyone knows that they can get vaccinated.
There is a great question here, and I've had other people ask me this question and just wondering, when given the vaccine, can it be done in a private setting? Someone who's experiencing a bit of anxiety with needles, totally understand that, and actually needs to have a little bit of a PRN or a lorazepam prior to a needle. It gets really upsetting. And can a secondary person be with them if given the vaccine, or is it something that can be done in a car? We've seen those sort of drive-through settings in some other communities.
Yeah, so right now our clinics are mass clinics in facilities and gyms and such. So we aren't offering it in cars right now. I'm not sure what down the road looks like when we begin our mass clinics in the summer. I hope that some do cater to people that need special treatment about their vaccines, so we can get everyone vaccinated that wants to be vaccinated. But yeah.
All right. I know that in Brant County, we had a staff person who was vaccinated and also, often faints. And so they actually provided her with a space to lay down for that. So it's not, it doesn't speak specifically to that particular situation, but they made her super comfortable. And she was really, really thankful for that she didn't have to fall off a chair and be embarrassed by that. So she said they were so accommodating. So I know that lots of really positive feedback around the clinics that way. There's another question here is around, can you ask for proof of vaccination? So I'm not sure if that's a question for an employer, or I know that.
Yeah. Oh, well, isn't that fascinating? So, the general answer to that question is if you're, we're not getting into vaccine passports and that kind of stuff, but yes, if it's a legitimate request of an employee to be vaccinated to come into the workplace, then yes, you can generally ask for evidence that they've been vaccinated. I know this sounds bizarre, but believe it or not, before I hire a lawyer, I check to make sure they have a law degree. I mean, it seems a little bizarre, but there have been people who have been hired by lawyers or as lawyers or doctors, and nobody's checked to see whether they graduated from medical school. So if it's a requirement, I mean, if it's a requirement to be vaccinated to work in a particular place, yes, you can ask for evidence of that or proof of that. Sure.
Okay, great. So many great questions that just keep coming. Someone is asking, there's a question earlier, scrolled up, Rachel, I don't know if you saw, it was like, if you got, say, Pfizer for your second dose, and can you have Moderna for your, so first dose Pfizer, can you have Moderna for your second, or you need to stay consistent with the maker of your vaccine?
Yeah, so staying consistent, getting the same 2 vaccines would be ideal, and it's recommended. We don't have a shortage on one or the other, so I'm hoping that will never be an issue for us to worry about. But yes, the same vaccine for both doses right now.
And Sydney, there was another question about pregnancy. So if you are pregnant and you get the vaccine, does the protection carry on to the child in womb?
Ooh, what a great question.
So just speaking about basic vaccine knowledge, if you're protected, it would help your baby be protected. I don't want to speak too much about pregnancy and the vaccines just because research is up and coming. I would recommend speaking to your family doctor about that. Yeah.
But that's a fascinating microbiological question, right? Because it depends on what goes through the placenta, and whether narcotics will, for example, right? So it gets really into some interesting chemistry, none of which I know anything about.
Yeah, it's actually very fascinating. So thank you for the great questions from everyone so far. Yeah. Risha, did you have one more?
Yeah, it's past 7:30. Our goal was an hour, and there are so many great questions, but gosh, here's another, and a lot of educator questions. So here, I think we'll throw this out. I'm not sure if we know the answer, but the asymptomatic testing that is set to begin after the April break within the school settings, what will the process be like, and what type of test would be provided? Sydney, is that something that you're familiar with?
I know it's coming. I can find the answer if you give me a moment.
You do that.
In the interim, there was someone who asked about can they get a vaccine in a medical setting because they're a senior with sensitivities and allergies. I would say you should talk to your care provider based on what Sydney was saying before getting a vaccine if in the past you've had allergies, especially severe allergies. Would that be accurate, Sydney?
Sorry, just repeat that last part there.
So they were asking about can they receive their vaccine in a medical setting because they have allergies and they're a senior with sensitivities and allergies. So I just referred back to what you said before, which was talk to their care provider about anything like that.
Yes, totally. We would recommend if there's any concerns or anything about getting the COVID vaccine based on what we say on our website, like our precautionary measures, anything like that, we would recommend a consult with a family doctor to get the green light.
You're
Good.
on mute, Risha.
I'm on mute.
Yeah.
Sydney, were you able to find the answer to that, or did we give you enough time about the asymptomatic testing in schools?
Yeah, so it's actually, the health unit is not running that. It's an outside vendor that is completing it. I know the asymptomatic testing is voluntary at the schools. It's not offered at all schools right now. There is different, certain schools on certain dates that are eligible to get tested. It's a regular swab that you would get done at the assessment center. What was the rest of that part of that question?
They were just curious about what type of test it would be and what would the process be like.
Yeah, so as far as I know, it's the same swab as you would get at the assessment center. So the nasopharyngeal swab. I can't speak to exactly what it looks like because it is an outside vendor that's completing the test. It won't be our health unit staff that is completing it.
Thanks so much, Sydney, for looking that up really quickly. There are still more questions, and we're not going to be able to get to all of them. I know that there's some lots of other great ones here. I think I'm going to get Rachel to maybe share her screen because she's got some phone numbers and websites for folks to see that will provide some additional questions and or additional answers for everybody, places to go that you can really count on. Do you want to speak to that?
Can you see it? Can you see the slide?
We can.
Good. Amazing. So we have resources, some of which have been shared already, but for the sake of everyone, we thought we'd share it again. So we have the Legal Clinic website, which is where you can find Ian. Also Arch Legal Clinic, specifically around disability law. And then general legal info, stepstojustice.ca. For anything relating to vaccine safety, the vaccine rollout plan, whether or not you're eligible to be vaccinated, when you're getting your doses, definitely we would refer you to the Brant County Health Unit website, which is where Sydney works. So it's bchu.org, and they have a COVID specific page that is updated very frequently. I would also say definitely follow them on Twitter and Facebook if you use social media, because they do really timely updates, and that's how I get a lot of my information. So if that's an inclination for you, go for it. But definitely anything about the vaccine rollout, Brant County Health Unit. For additional information for folks who are super curious, we have the Government of Ontario website. They also have a COVID specific page, and they also include information on vaccine safety. And then there's also the Centers for Disease Control website, and they have some really great resources about info on the vaccine, including myths and facts and frequently asked questions. So that goes even more in depth on some of the things you might have heard about the vaccines, like particularly maybe the AstraZeneca vaccine, because I know that's been something that's publicly discussed right now. There's lots of information addressing some concerns that folks may have. So those resources are readily available for you. So that is the closer.
So a note here in the chat from Carrie Sienkiewicz from the Legal Clinic. I'm just letting people know that you can, from the website, from the Legal Clinic website, you can reach Steps to Justice as well, which is a real awesome one-stop shop for legal questions. And there's also a contact form on their site. So if you have any questions, that's to the very first link that you see there for the Legal Clinic, head there, and that's a super resource for everybody as well. Excellent. What I'm going to do is just want to say thank you, and there's some great comments coming in the chat. Please do feel free to leave us with a word. I've got three sort of poll questions, just quick evaluation questions for you. So I'm going to launch that poll, and if you could take just a couple seconds. So the first question is, were your questions about the COVID-19 vaccines answered during this webinar? So all of them, some of them, or none of them. So please, we'll take just a couple seconds to do that question. And a bunch of folks popping in there. It was amazing. Thank you. All right. And I'm going to do, we'll share the results. So we're getting some good stuff there. Thank you. That's so, looks like we did some pretty good. There's more questions. There are so many good questions in the chat. I wish we had all night. And I'm just going to do a couple more, 2 more questions. If I know how to do this. This is my first time doing polls. So please I'm going to stop sharing that. And I'm going to do the next question. And the question is, participating in this webinar has helped me make an informed decision about the vaccines. So yes, no, still undecided, or some of you may already have your vaccine.
And just a side note, if anyone's questions weren't able to be answered tonight, I'd encourage you to go to our Brant County Health Unit website. There is a COVID specific email that we have that is monitored, and we can answer questions via email if they weren't able to be answered today.
Excellent, thank you. That is great. And perfect. And our last question is, did you learn something on tonight's webinar that you think you'll share with someone else? Yes or no? Well, lots of yeses coming. I learned some things too, for sure. That is great.
And I want to send along my thanks, particularly to the educators out there in the audience. I was lucky enough to have a couple of high school teachers that managed to keep me out of jail and got me into law school. So there's some love for the high school teachers out there.
That's great. Thank you, Ian. We're glad that you were with us tonight. And I would like to, just as we wrap up again, just to thank Ian for taking the time, and Sydney for taking the time and looking things up on the fly for us, which is amazing, and the organizations that you represent. Rachel, who coordinated all of the work to get your questions and answers in advance to the survey. Linda from Accessibility Solutions, who helped keep us on track this whole time as well. So, and to my own organization, Community Living Brant, for hosting the webinar. So I want to thank all of you, though, for taking the time to be with us tonight, and amazing questions. I'm sorry that we couldn't get to all of them, but again, please do check out these websites, and to find out more, contact. I know, Ian, you're getting a call tomorrow from somebody, so that's awesome, around childcare. And again, thanks to all of you out there, folks from agencies and citizens, for doing good work, and all the best. Stay safe and stay well. Take care. Good night, everyone. No offense to any of you, but we will have you all go. Thanks so much again.